Hey guys, Dr. Jordan Miller here with Integrated Health Solutions, and today's video health tip, we are going to go over a great banded exercise for shoulder pain, shoulder impingement, any type of mobility problem or limitation that you have with the shoulder. Now, shoulder impingement is a very common and realistically just kind of annoying condition that we see a lot in the office. Here's a great exercise to create some mobility, but more importantly, create a functional mobility with the shoulder. Now, typically what happens and what we see with an impingement or any sort of dysfunctional motion in the shoulder is we use a lot of this upper trap, this muscle that does a lot of compensation. So when we need to move and guide the arm and the shoulder, the upper trap feels the need to take over and create that motion and do it for us, which then creates a dysfunctional usage of the shoulder joint, the rotator cuff muscles, the deltoid, the latissimus dorsi. All of these guys like to kind of work together, but when they're doing different jobs, then you create a dysfunctional pain. So this banded exercise does a really great job of eliciting the correct motion, making sure that you're not overcompensating using the wrong musculature. So in the office, we here use a simple band. Now, while this is not a commonly, hey, everybody around the house has one of these, if you have a towel or if you have a t-shirt, realistically, all you need is something that you can grab onto to create a little bit of that resistance strength between the hands. The goal of the exercise is not necessary for, hey, I want to create external rotation with a band here. This is just simply something that we all have, so this is what we use. So all you're going to do is you're going to start by getting a good grasp on either side of the band, towel, t-shirt, whatever you use. And again, we're not creating too much rotation. You just want to make sure that this is nice and taut to avoid that really, really heavy stretch or a little bit of that kind of flaccidity in the stretching band itself here. Now, ideally, you're doing this in front of a wall or a door, something that is parallel to your body that you can bring your forearms to. Now, there are going to be three typical motions that you're doing with this. As your forearms are parallel to something in front of you, with a little bit of stretch in that band, what you're going to do is you're going to take the shoulder blades and you're going to pinch them together, okay? So you're going to retract those shoulder blades as they're coming closer towards the spine. Then you are going to protract those shoulder blades, separating them, pushing away from the spine, again, while maintaining that good stretch on the band here. And then while you are in that protraction, what you're going to do is you're going to give me a gentle elevation of the arms here. Now, what's very important is as you're elevating the arms, again, you're not elevating the shoulder. So there is a clear difference between this motion and this motion. Okay, what we're trying to do is drive that scapula and that shoulder blade into the upward rotation without needing elevation to take its place and do that. So ideally, a simple stretch, little shoulder retraction, little shoulder protraction, a little elevation, depression, and rinse and repeat. Same thing back and forth, up and down, making sure to be very, very concentrating on the motions. It's not about how quickly you can get through it and making sure that you're doing as many as possible. It is about making sure that you're doing them all very well. So this is a great exercise to do around the house, at work, anytime you're feeling like the shoulder's a little bit stuck or you're not necessarily feeling that functional movement. Try this exercise out at home. Comment any questions below and stay tuned for the next video.